Through JCR Consulting, we're really able to go into whatever type of organization that we're working with to identify vulnerabilities and to identify processes that may be broken, that potentially could cause harm to the patients, but then at the same time assist them with developing a process that's going to work for them, and not just the Band-Aids, but really helping them to rework the processes, come up with significant changes that may be helpful going forward to really help them get to that zero harm.
I don't think anyone else can really compete on the number of different settings that we bring expertise to. So whether that's hospital, ambulatory, long-term nursing care, home care, we have consultants that are experienced in all different settings, as well as we have in-depth expertise across a lot of different specializations, including infection control, medication management. We have quality directors. Really anything that you're looking for, we probably can meet those needs.
We've worked with a lot of different systems. We've worked with critical access hospitals, and each of those individuals have very different needs. Sometimes they may just need some outside eyes to help them maybe make a change that nobody believes they need to make. And when they have that outside eyes and that outside person saying to them, you know, we need to really make this change, it sometimes carries a little more weight. And I think we've often seen that as a real positive and heard that from our clients as well.
So consultants at JCR have many different backgrounds, but they're typically clinical experts in a certain field or have been past facilities directors. So our consultants are nurses, they're physicians, they're infection control specialists, medication management specialists, pharmacists, and they really have run the gamut of different expertise within the healthcare settings.
Our consultants are trained and receive much of the same education that the surveyors do. And so with that being said, it really ensures that we are giving good information, solid information, and we're not leading them down paths that may not really be where they need to go. So we really hope them to focus on the strategies that are going to best help their patient care.
So at JCR, we do a lot of different services. We're probably best known for our mock survey, but we do many other things. So we also do custom education. We have interim staffing services. That can be for a quality director. That can be for an environment of care facilities director. We have continuous service readiness, so to keep a consultant at the ready to answer your questions and help with any specific needs your organization might have.
Some of the hot issues we're working on is the recent 411 issues that came out from Joint Commission, and Dr. Chaston talked about the surveyors focusing on these major 4 high-risk areas in hospitals. They cover everything from sterile compounding to high-level disinfection and sterilization to suicide prevention and then dialysis services. These are high issues that are being cited, but we have the experts to really help organizations in those areas.
So a large system may have their own internal team, and we can supplement their teams by providing consultants that may be nurses, or they may be physicians, or perhaps they're facility directors that can help with EOC and life safety findings. And we can really fit into another organization's way of performing a mock survey to help them as well. Just recently, a very large medical facility reached out and said they had the absolute best mock survey that they've ever had. And they attributed that greatly to the expertise of our team. It was a large mock survey with many different specialties involved. And throughout her organization, she said at many different levels, there was continuous feedback that was the absolute best mock survey that they had experienced, and they got a lot of great benefits out of it.
In order for organizations to start their journey to zero harm, they really need to get not just the frontline staff on board, but they need to have their leadership and their board to be ready to move forward, to really make a statement. Those that are walking the walk and talking the talk have really embraced it. It's not just about zero harm, it's about being a high reliability organization. It's about being willing to dissect every serious event that happens to say, how can we prevent this from happening in the future? It's also being willing to identify proactively what they need to do to prevent harm ever happening. So it's not just reacting to a serious event, it's also being proactive in the process as well. It really is a long journey, and it takes leadership, it takes everybody together to work on that.